Diabetes on the whole is when there's an inability for glucose to be absorbed from the blood into the cells. Now the body has an organ named the pancreas that secretes insulin that takes that glucose out of the blood into the cells to be used. Now what happens? Somebody is diabetic when this does not occur or something impedes it from happening. And in pregnancy, the placenta produces some hormone that makes it difficult, or what we say a state of insulin resistance, where it doesn't work exactly. So even though most women are able to compensate, their body produce a bit more insulin to take that sugar out of the blood, not everyone is able to do so. And that is how we have something what we call gestational diabetes. During the second half of pregnancy, approximately 20 to 24 weeks, is when the hormones are more prominent and makes it more resistant for the glucose to be used. So we do a test called the oral glucose tolerance test. It's done between 24 to 28 weeks of pregnancy, where we look to see if a woman is developing gestational diabetes. If any of the figure to that test is positive, then you're diagnosed as positive. Now, what does it mean for this woman? Once somebody is diagnosed with gestational diabetes, there are complications that can occur in that pregnancy for both the mother and the baby. Studies have shown mothers who are diagnosed with gestational diabetes, approximately 30 to 60% can go on to develop type 2 diabetes in 10 years. If you develop gestational diabetes, it's left uncontrolled, that baby is exposed to all the glucose, then that baby is at risk of developing type 1 diabetes in early childhood, and that is something that we really want to avoid. Now, how is it managed? There's different ways we can manage, which is non-medical and medical. We usually start off with medical nutritional therapy, which include diet and exercise, where we'll advise you what you should eat, and we also recommend daily testing your fasting glucose and 2 hours after meals. It could be breakfast, lunch, or dinner. Once we have this reading with your diet recorded, we're able to adjust your diet to see if it can control your glucose level in your blood. And if it's not controlled, then we move on to using medication. There are multiple complications that your baby can suffer from you having diabetes, or if it's unknown or not properly controlled. So what we recommend if you become pregnant, you should be screened for gestational diabetes because it's something very important, and to avoid complications for both the baby and the mother.